really great that CDG is having this conversation, because I think what the perspective that you bring to what's going on right now in the world is not just how we make the right decisions for the moment, but how we make the right decisions in the moment for the future. And, you mentioned some of the work that Merck for Mothers has done in innovative financing, and how that can either inform or help us think differently about our responses to COVID. And I'd like to link that to the fact that, all of the work that we're doing, whether it's the Ministry of Health in Nigeria, whether it's the World Bank Global Financing Facility, all the work that we've been doing in the years and months leading up to COVID, those are the investments that we've made in health system strengthening that ideally, would help us weather the shocks, of COVID. And so I want to speak, to some of those based on your question around innovative financing and the link to availability, affordability, quality. And then I also want to add the aspect of access. So in terms of availability, Dr. Sama, you mentioned that, one of the things that the ministry has had to deal with is the need for increased healthcare workers, human resources for health, and how you've had to divert and redeploy workers within the ministry. I do think that the private sector can be a place to augment capacity in the health system. And we're already seeing that play out in COVID, whether it's here in the United States or countries across the globe, where local private providers, whether they be physicians, nursing homes, midwives, pharmacies, as you've mentioned, supply chain distributors, many, of that sector has really stepped up, raised their hand, and are looking for ways to help governments respond to COVID and augment their capacity, for this response. And their ability to do so is based on some of these previous innovative financing investments. And I'll share one that Merck for Mothers is involved in through our Moms Initiative partnership with the U.S. Development Financing Corporation. And, that's a $50 million initiative to provide growth capital, debt financing blended with grant financing to social entrepreneurs so that they can scale. And we know that this ability to scale and scale quickly we're seeing the necessity for it in COVID, but it's also going to be critical for us to meet our SDG goals. And so the ability to bring in new capital, new private financing to support local private sector and social entrepreneurs, is critical for the COVID response. The other thing that it does, and I can't remember if it was Monique or Dr. Sama that mentioned this, but we are investing in local economies. And we know COVID is having a huge impact on economies. When we think about our response, we should also be thinking about how it can help to fuel and jumpstart local economies. The second point you mentioned was around affordability. And you're right that a significant proportion of women and adolescents seek services with local private providers. In many countries, in many states in Nigeria, it can be up to 60 or 80%. And depending on where you are and the out-of-pocket costs that consumers may need to pay to augment services, in the public sector, our ability to invest in financial platforms, whether they be health savings accounts that can blend funding flows from health insurance schemes, from donors like Merck for Mothers, pool together out-of-pocket costs, pool together potentially employer insurance. That pooling of money on digital platforms allows for increased affordability and increased access to services. And I think a lot of the impact investing in innovative financing, as you mentioned, in mobile tech and fintech, will allow for this rationalization and hopefully efficiency of funding flows. The third point was around quality. And I think we need to be very careful as we respond, in the moment to scale up services around COVID, that we are also paying significant attention to quality. We know, through studies from the Lancet have shown that 60% of the deaths that we see in around primary care maternal health are due to lack of quality, not necessarily lack of access. And so a lot of the innovative financing mechanisms have an ability to tie payments to quality and to outcomes. And I think that that's something that we should continue to make sure happens through this emergency response. So we are not shortchanging ourselves, and more importantly, shortchanging patients who are seeking services. And last but not least, I'm actually happy all of the folks on this panel have already discussed the important demand side of this equation, because it's not just the lack of supply of services that we're seeing have an immediate impact on poor health outcomes. I think, Monique, you mentioned, predicted models predicting 100,000s of women dying due to lack of access to high-quality maternity care. We are already seeing from data on the ground, which I'm sure you're aware of, dips in service utilization, 40% reduction in seeking antenatal care, 40% reduction in seeking institutional delivery care. And a lot of this, as my co-panelists have already mentioned, is because women and their families are scared. They don't know when to seek services, how to seek them safely. And as Dr. Salma mentioned, the ability of personal protective equipment to be available wherever they seek care, whether it's the public sector or private sector, we know that there are huge gaps there. And so I think what COVID has taught us, not that we didn't already know this, but it's really emphasized, is that health systems don't stop at the facility. Health systems stop at the patient, at the person. And so as we think about our responses, as we think about how we strengthen health systems, we need to really make sure that the connection between people and patients and facilities are there and are strong. We're seeing, huge increases in the deployment of technology that allows for real-time communication between patients and their providers and facilities. We need to, from my perspective, double down on this and make sure that those technologies are scaled so that patients can get the right information at the right time that's specific for them, so that they can seek the service that they need in a safe way. And this is something that I'm excited that COVID is actually surfacing because there's a lot of work that we can do here. And I think that there's a lot of opportunity for innovative financing mechanisms to help scale these new types of technologies that will closer connect patients and people to the health system.